If you've heard that New Zealand is introducing 12-month prescriptions and thought, great, this will save me money, there's a little bit more to the story, so let me explain. Hi, my name's Dr. Jo Tooby and I'm a working GP in New Zealand, and in this video I want to explain when the 12-month prescriptions start, what's really going to change, who is eligible and what it might mean for your care. The official message has been longer prescriptions should make it easier for patients to access their medications. Sounds simple, a win for everyone, right? But actually, there's more to it than that. The truth that most patients don't hear is that prescription length is not about convenience alone, it's also about safety. And that's why longer prescriptions are only appropriate for some patients. From the 1st of February 2026, GPs and other prescribers in New Zealand can issue some patients prescriptions for up to 12 months for stable long-term conditions. The goal is to improve convenience and for some patients reduce costs while keeping your care safe. Even with a 12-month prescription, you'll still collect medicine in 3-month instalments, or 6 months for the oral contraceptive pill, from your pharmacy. The decision to extend prescription length or not belongs with the prescribing clinician and is based on professionally agreed eligibility criteria. And these criteria are that your condition and medication dose must have been stable for at least 6 months. You don't need regular monitoring like blood tests or blood pressure checks. The medicine is approved and legally allowed for 12-month prescriptions, and you agree to a yearly in-person review to check your medicine is still suitable. Ultimately, the final decision rests with the prescribing clinician. Your health and safety always comes first, and your prescriber has medico-legal obligations to fulfill when writing a prescription. Some prescriptions will never be eligible for 12 months, according to current legislation, and this, at the moment, includes controlled medications such as opioids, stimulants, and ADHD medications, medicines taken only as needed, conditions or medications that require monitoring within 12 months, and medicines where your dose or condition has changed in the past 6 months or is likely to change in the foreseeable future. Even if you get a 12-month prescription, your medicine will still be dispensed in installments at your pharmacy, which is 3 monthly for most medicines and 6 monthly for oral contraceptives. You won't be able to collect 12 months at once, and you will only pay the co-payment, for example $5 per item, on the first collection. If you don't pay for your scripts currently, you will not have to pay for your prescription. Whether or not the 12-month prescription saves you money at the GP end is a little bit nuanced and does depend on how your GP practice plans to roll out the 12-month prescriptions. So I think I'll cover that in another video. So just to recap on the safety and monitoring aspect of prescribing, longer prescriptions are not automatically better. They do have to fit your own health needs. If anything changes with your condition or your medication, your GP may shorten the prescription again. So if you do get 12-month prescriptions, it may change in the future. If you run out of your medicine early or your dose changes, please try to contact the prescribing clinician as soon as possible. The prescribing clinician is responsible for the 12-month prescription, and therefore the assumption is that you'll be on the same medication at the same dose for 12 months. So if anything changes, including if you start new medication, please inform the prescribing clinician or your pharmacy or your GP practice so that your medication can be reviewed. If you're worried about seeing your GP less often, please don't be. You can still discuss your health and medicines whenever needed. The aim is not less access, but easier access. To sum up, 12-month prescriptions start from the 1st of February 2026 for some patients. Eligibility depends on stable health, stable medication, and suitability for your GP's clinical judgment. Some medicines, like ADHD medications and other controlled drugs, will remain on shorter cycles. You'll still pick up your medicine every 3 months or 6 months for the oral contraceptive and co-pay only once. Safety and regular review are still the priority. The final decision rests with your GP or prescribing clinician, because they have medico-legal obligations and your health and safety remain their priority. The key takeaway, therefore, is that longer prescriptions are about making your medicine easier to access and safer, not about reducing your care. If you found this video useful, please subscribe to my channel. I plan to do a video on will 12-month prescriptions save me money at the GP? Thanks for watching.